How on earth, how in God's name do you, the NIA, justify going ahead with the national identification registration in these unprecedented times? As of tonight, the coronavirus pandemic has claimed 10,444 lives across the world. Lives. I mean, human lives. Now, this virus is no joke. Clearly, the NIA is either very irresponsible or simply negligent. Whichever one you decide they are, it is simply not acceptable to put human lives at risk just so that they can get an ID card. I mean, think about it for a minute. The NIA has chosen to put Ghanaian lives at risk just so that they can issue them with ID cards. It simply does not make sense. The NIA somehow managed to issue some directives it claims will mitigate the impact of the virus, as if they know the virus more than the scientists, and keep it from spreading in the midst of the long queues. This is what they said.
All supervising registration officers, SROs, are to ensure using appropriate queue management techniques, including numbering and appointment systems, that no long queues emerge at any registration center. Where queues become unavoidable, the officials should strictly adhere to the maintenance of the 2-meter social distance advised by healthcare professionals.
Well, guess what? The NIA has so far failed woefully to implement these directives. Just today, and I'm sure you heard it on Top Story, our Eastern Regional correspondent at midday did a tour of some of the registration centers and found mass gatherings fertile for the spreading and transmission of coronavirus outside the designated registration halls. Now, this is why we must all be very upset and demand as citizens that the NIA respect our right to life and postpone this irresponsible registration of people at this time of great global calamity. So the NIA has not still heard that in Ghana we now have 16 confirmed cases. The NIA has not heard that that number is now set to rise, exponentially rise in the next few days. They have not heard that Ghana now has community transmission of the virus. I mean, they have not heard the chilling pronouncement of the health minister. Let's pretend they have not. They should listen.
We seem to have got close to about 600 people that we are trying to trace to check on them whether they have already contracted the disease. And I know the number will be more. So for the next few days and weeks, we are anticipating that we're going to have larger numbers of people who are already having the disease. Over the last 3 days, almost every day we get a case. So going forward, we may begin to grow positives exponentially, and that is becoming a very dangerous situation for all of us.
I mean, need I say more? People, this is no longer a joke. If the NIA thought it was ever a joke, what you just heard there should get them out of that slumber and just postpone the registration. We're not saying cancel. We're not saying scrap. Yes, we know you spend money on it. We know. Postpone it. I mean, we are in dangerous times. Just to paraphrase the health minister, lives are at stake. So those who run the NIA, they know better than the health minister on the coronavirus. Are they telling us they know better than the health minister on this virus? Are they telling us that they know better than the WHO? That they know better than the Ghana Medical Association? And of course, they are telling us that they know better than the Commander-in-Chief of the Ghana Armed Forces, the President of the Republic.
All public gatherings, including conferences, workshops, funerals, festivals, and religious events such as services in churches and mosques have been suspended.
Now, the President, the Ghana Health Service, the GMA, the WHO have all said no gatherings, and yet the NIA proceeds with impunity. But this is the shocker. Why has the President failed to stop it? After all, it is his directive that the NIA is violating with impunity. Why has he failed to stop it? If the President will not stop them, maybe the court will, and it must, sooner than later, before the NIA's irresponsibility kills us all. Well, thankfully, the NIA is not my focus for Ghana Connect tonight. I leave them to you, the people. And I must also spare a thought for those in the Eastern region who still want to go and queue and put their lives at risk to get a card. If the NIA will not cancel it, just leave the space for them to sit there alone with their machines and register the empty space. If you choose to go there, you're putting your lives at risk. There is community transmission now. I have a doctor in the city. Maybe he will explain to you what community transmission is, so you appreciate how grave this challenge we are facing is. And of course, as I said, it's not my focus tonight because the court maybe will deal with it decisively. Let's see how that goes. Well, tonight we are confronting the coronavirus reality. It is going to get worse before it gets better. We've heard that from the health minister. So what do you need to know to stay alive? That's the question we are asking to Ghana Connect. We'll connect experts, people living with the virus we are not in government isolation, Ghanaians in European epicenters, Ghanaians everywhere, to answer your question as we approach that, what the health minister calls dangerous times. Connecting the studio is Hannah Lisa. Connects with me. Hello, Anna.
Hello, Ivan.
And she's a doctor herself, and she's on the front line and working in the facility. I'm interested to hear what her thoughts are. On the phone is a Ghanaian who tested positive for the virus, one of the 16 cases recorded in Ghana. He is currently in government isolation and has agreed to connect with us tonight. We will call him Mr. Mensah, not his real name. Hello, Mr. Mensah.
Hello, Evans.
Great. Thank you very much for agreeing to join us tonight. Also connecting on the phone tonight is Dr. Michael Owusu. He is a research scientist at the Department of Medical Diagnostics at the KNUST and a researcher at Kumasi Center for Collaborative Research, now the second coronavirus testing facility in Ghana. Hello, Doc.
Hello, Ivan.
Doc, thank you very much for agreeing to join us.
Thank you very much.
We will be live in European epicenter of Italy and in Germany and speak to Ghanaians who are on lockdown, surviving the virus. We can learn a few things from them. As you've heard already on Top Story, some experts in Ghana are already advising the government should move into a lockdown. Well, we are not there yet, but some are already there. Let's see what we can learn to stay alive. Also connecting later is international photojournalist and blogger Nana Kofi Akwa. Guess who was in the studio with me? Annie Osabute. I say you don't need to be an expert nowadays to talk about the virus because it's affecting all of us. We're all learning new things. We're all trying to stay alive. And he's staying alive himself. He came here with a fake. He came here with a fake hand sanitizer. We'll talk about that very shortly. Part of the things you need to know to stay alive. Don't follow Annie's example by buying a fake hand sanitizer. Mr. Mensah, I want to start with you. How are you doing tonight?
Evans, first of all, I'd like to say hello to Ghanaians and to your listeners. By the grace of God, I'm doing fine. I'm in perfect shape. I'm in high spirits, and I believe that is the way forward.
I'm really excited to hear you are in high spirits. Maybe share with me, how long have you been in government isolation?
For 3 days.
For 3 days.
Yeah.
How is it like? Describe for me, how is it like to have tested positive and have been kept in government isolation? Describe that whole, what is it like?
You know, Evans, I'm the type that love to go out, love to meet people and have conversation with them. But, you know, sometimes when there is a need for you to sacrifice in the interest of society or public safety, you have to do so. Yeah, staying in the isolation center is quite difficult because you are locked up in a room where you can't go anywhere. You only receive friends, maybe one or two who comes around from and stand at a far distance, just say hello to you, and you have professionals who always want to find out how you are doing. It's quite difficult because it's not a normal life that I expect any Ghanaian to go through. But hey, this is where we find ourselves. You cannot risk the entire population at the expense of your freedom.
And how are people treating you generally? I mean, I'm just curious to know. I mean, your family, your friends. I mean, of course, they can't come close to you, but I'm sure they know. You in this time, I guess you need that community more than ever. Even if they can't get to you, but reaching you some way, somehow. What are people? How are people reacting to you?
Evans, let me say, with respect to my family, I believe as of now, all of them know my status. My wife, my kids, they have been telling me, look, Daddy, we are into all this together and we'll come out strong. Don't be broken. We are going to be with you. We are praying for you. And I believe that is the things that people should be doing now. Unfortunately, we have some Ghanaians who believe that it is a crime for someone to have this pandemic or this virus at this material time. And sometimes it's quite challenging. Because basically, I don't think there is any Ghanaian out there who would love to go and have this virus. Most of us, we were on official assignment and we had it. For the love of our country, for the love of society, we decided to go and get tested. But people feel like, oh, once he's tested, he has become the odd one that we have to isolate in society. But that shouldn't be the case. I've heard several things happening around my family where now it's like everybody is stigmatizing them. No one wants to get closer to them, not necessarily to have a contact with them. But I mean, people who are not affected by the virus and have one or two connections with my family are being affected by virtue of this virus or pandemic. And I believe that is not the right way to go as a society, because as a society, we need a collective effort to deal with this pandemic. Look, coming out even to say, I want to test, is a big thing that society must appreciate, because I could have kept it to myself because as I stated from day one, I was quite healthy, and most of the people out there were just like me. I could have gone out with my normal activities, and no one would notice that, oh, this gentleman has got this virus. But I believe it is in the interest of public safety for us to avail ourselves when we realize that we have such symptoms. And coming out and thinking that society should rather sympathize with you or show love to the people around you, and rather you see them more or less stigmatizing. It's very painful. Personally,
go on.
Hello?
Yes, please, go on.
Personally, I am a strong guy. I don't think I'm going to move by those things, but I'm thinking of my family and then the rest of my colleagues who have been infected by the virus, how they are going to integrate into society. And I believe society should understand that if we continue in that line, it would discourage people from coming out, and we will experience exactly what is happening in other countries, where people are not willing to go out and get tested and feel like, oh, let me keep it to myself. And you and I know it has been announced by the health minister that now we are having local transmission, and that is very dangerous. That is very dangerous.
And it's very dangerous, and it comes to the point you're making, because once there is community spreading and transmission, it's difficult now to do contact tracing and look for them. And you have to rely on people's own willingness to come forward to say, I think I may have come into contact with somebody for testing. Exactly. And the point you're making, which is so important to emphasize, is that if we begin to stigmatize those who come forward, like what you're describing is happening to your family, then these people who will be spreading within our communities, they may know they are, but they will not be willing to come forward and be tested and isolated so we can bring this under control. What you're saying is so crucial. I want you to hold the line. I want to bring in the experts in this area. Dr. Owusu is an expert who joins us on the telephone line. Doc, yesterday you first hinted that we may be approaching community transmission of the virus. It has been confirmed now by the Ghana Health Service and the Health Ministry. When you're listening now to a Ghanaian who's tested positive and is telling you about the stigma and how they maybe might affect people coming forward to say they are and be tested, what is the danger if we continue to stigmatize people at the time when we know there's community spreading and transmission?
Thank you very much, Evans, and good evening to all your listeners. So I think that the patient has hit the nail right on the head, and I'm happy that he's trying to express this is a personal worry. And this is what you see about outbreaks of this nature. And the world has gone through this over the years, talking of the era of the Spanish flu, of the SARS, and the recent Ebola, Ebola in Liberia, in Guinea, in Sierra Leone. Stigma was one of the reasons why people did not want to own up and to say that they are either sick or they are having fever. They hid it in their homes, and this spread rapidly. So the issue of stigma is a whole thing that we have to deal with it. And you are confident to deal with it when patients themselves, because a clinician or a doctor cannot put out a patient name out there that this patient has the disease. It will be against any doctor's oath that he has sworn. But if you have people who have the disease and mentioning their names and telling the public that yes, they have the disease, they are in isolation center and they are recovering or have recovered, this boosts the confidence of many other people who may be hiding. And one thing I say is that this disease has close to 90% recovery rate. So you should expect that close to 90% of people who are infected may have mild disease and may recover. We are talking about 5 to 10% who may progress to the severe stage, which will require hospitalization and perhaps be put at place like ICU. So for me, we should not begin to do away with this stigma, encourage people to come out to test and make their status known, and then let people just own up. Because if you are in this level of community transmission where you can't know the contact, you don't know who has touched what, people don't know how they got the disease, it means that whoever you see is a potential person who has COVID. This is what I tell people, that whoever you see now and is coughing is a potential person. So very soon the criteria of saying that somebody has traveled from outside or he has been in contact with a COVID positive patient may not work anymore. It means any other person who is coughing, has fever, has difficulty breathing, should own up and should just call the hotline and should get himself tested. So this stigma, I think that is one thing that we have to deal with as a country, remove these barriers and encourage people to just come up. And once we have more testing, more people will be isolated and they will be able to protect those who are negative and deal with the positive cases, manage them, and once they recover and then they don't share the virus again, we take them back to the community. And that is what we expect that we do as Ghanaians. If we don't go that direction and people begin to shy away and keep it within their communities, then there will be a spark of this outbreak, which will be very difficult for us to manage as a country.
Let me bring you in, Annalisa.
Yeah.
What's your own thoughts on this?
Well, the stigma is a big problem we are dealing with. It's making it very difficult for people to come out and tell us that this is what is happening to them. That's why people stay at home till they actually see symptoms before they come, and sometimes they would then progress to severe forms of the disease. Sometimes people are even scared to tell you that they are coughing. So my question is, before coronavirus came, the new coronavirus came, were people not coughing? Were we not treating normal coughs? Were there not illnesses that came with cough? And that's why people are hiding in their homes, and that's why the numbers would increase, not as a curse, but because of the way we are going about all of this. When we had certain countries where it had been confirmed in certain countries, people started stigmatizing against certain nationalities. Now that we know that Ghanaians have it, are we going to stigmatize against Ghanaians too? Are we stigmatizing against Ghanaians with accents, assuming that, okay, this person is coming from UK or from America? And that's a big problem. The stigmatization is one of our biggest problems when it comes to this disease.
Mr. Mensah, let me come back to you. Are you showing any symptoms yet?
Evans, to be honest with you, I have not shown anything there.
Goodness
I
me.
don't cough. Even if I cough, it's just like any normal cough that I used to. My body temperature ever since I returned from the trip has been normal. That is 36. Sometimes I have 35 to 37. I have never crossed that threshold. I don't sneeze. I don't have any flu. everything is okay. I'm very active. I am very active, and I can tell you that most of the people out there who believe that they are very strong, I might be stronger than them. But the point is, once you are confirmed to have the virus, you need to go through a process, and you must agree to subject yourself to the process. And that is exactly what we are doing.
And I must really commend you for doing this. It's an example, and I guess it's the reason why you agreed to talk to us, so people learn from your experience and take that initiative. How long are the doctors predicting you will be in isolation, and what treatment are they giving you?
Basically, I don't think I'm going to be here for a very long time. Hopefully, Monday they are going to do my next test, and I'm confident enough that it's going to be negative. And I presume that by then things should return to normal.
Great.
Once the test comes out, I think it takes between 6 to 8 hours for the test to come out. And once it comes out and they confirm, then yes, you may have to leave for the house. And beyond that, I believe everything should be normal for each and every one.
I mean, just before you go, I have on the line, obviously, an expert in this field with the KNUSC, Dr. Owusu. He's a research scientist, Department of Medical Diagnostics. He's also the researcher at KNUSC Collaborative Research Center there. If you have any question you want to ask him in this particular situation, just for clarity, you're free to do so.
Basically, I don't have much to ask because I believe when I came here, I spent time with most of the professionals over here. You know, I'm the inquisitive type, so I love to understand what is happening to me, and I love to understand the way forward. So most of the experts here has really briefed me, and I think I'm okay with it. But just that I want to emphasize that let's stop the stigmatization. Let's encourage people to come out to test, and then let's show them love. Those are the key things when we do as a society, because the propaganda out there is too many. People manufacture lies. For instance, when I was the one who called the Ghana Ambulance Services and then Ghana Health Service to take me to the center, it's all over the place that, in fact, I was arrested and put into an ambulance to the center. And you see, things like this are not healthy when we are trying to fight this pandemic. I believe that is not the right. People should seek for the right information. There are a whole lot of misinformation out there, and I believe the media also have the duty, just like the way you are doing, to correct those misinformation out there. People think when you have the virus, the next day you are going to die. But that is not it. We have success story, and that is what we should be celebrating as Ghanaians, that so far we have not recorded any death. They are recovering.
And we will not, as we are speaking this just out of optimism that we will not. I mean, all of you will recover fully. Just before you go, are you on any particular medication? What sort of, because they say there's no treatment, there's no cure for it, but are you on any particular medication to help anything?
Let me say that there's no particular medicine that we are taking. What I have been on is vitamin C. I'm told my immune system is very strong and it should be able to overcome this virus. So ever since I came here, it is the vitamin that they make sure we eat well and we rest well. We drink a lot of water to boost our immune system and to make us healthy. And that is what is doing the magic. No medicine, I don't know, unless your situation is very critical. But it's based on individual case. In my case, so far it has been vitamin C. I have not taken any extra drug apart from vitamin C.
I am very grateful that you joined us, Mr. Mensah. That's not his real name. He's agreed to talk to us. He's currently in government isolation, and he is doing fine, and we know he will do fine. Dr. Owusu, so let's start with the public education bit, because he said a lot there that I think we need to sort of unpack. It's very important, right, that if you feel that, what should you do if you feel you've been exposed?
The Ghana Health Service, the Public Health Division, both in Accra and Kumasi, have put out hotlines which are available and are always being announced by the radios. So once you have a symptom, once you don't feel well, you are not able to breathe, you call this hotline, and then the dedicated persons will come to wherever you are, collect your samples. In the case in Kumasi, for instance, they will drive to wherever you are, collect your samples, bring it to our center. We will test these in our labs. We will run it. When the results are ready, we deliver to them. And then if you are positive, they move you to the isolation center. Then they manage you. And if you are negative, then you can go ahead and do what you have. But if you have in contact with somebody and you don't show the symptoms, then you can quarantine yourself for about 14 days, I will always say, and keep looking at and monitoring yourself, where you have this social distance. You don't come into contact with your family. And then whenever you feel you have the symptoms, you just draw their attention and then they collect your sample. But what I want to put across is that in the era of community transmission, you don't have to say that you have been in contact with somebody who has traveled. Once you have the symptoms, once you have difficulty breathing, while you have the fever, just go ahead and call the line and then you'll be tested. I'm happy that for some hospitals, even you can go to the hospital, those that are dedicated, especially in Accra, where they will do pre-triaging. So if they feel that you fall within that line, they will direct you through a path that you have to go, and then you join these groups who are suspected of COVID. They will collect your samples, they will test it for you. If you are positive, then you can go into isolation. This is very important because the major deaths across the globe is overwhelming of hospitals. When many people troop to hospitals, and then you have the hospital cycle of infection spread around. Then you put those who have underlying clinical conditions and who are aged at risk. In Ghana, for instance, where you have about 300,000 people with HIV, people have tuberculosis, others have diabetes. Many people have many conditions, and many of them are already on admission. So you wouldn't want a patient to just move and overwhelm our already overstressed hospitals, making it difficult for us to work with. Like I said, if you have about 90% recovery rate and you have 5 to 10% going to severe illness, then we can reserve our limited hospitals for these 5 to 10% and then manage those with mild cases, perhaps at our isolation center. So we'll be able to free space for people to come in whenever they have to be managed. So people should be able to cooperate with the directions given. And once we're able to adhere to that, we should be confident that we'll be able to fight this together as a country.
Annalisa?
Yes.
On the same question about...
Yes, so I think that I'm very happy with the things he's mentioned. I think that there are hotlines, there are numbers that you should call. Now, the most important thing in all of this is that we need to be kind to each other and we need to be each other's keeper. Like, for example, you find out that today, I heard on the news that we run out of face masks and we run out of gloves. For the sanitizer story, you all know about it.
You are in the front line, so people know what you're saying, you know what you're talking about.
Yes. We run out of face masks in certain hospitals, and they're under lock and key. And we run out of gloves. And on the markets, we are running out of them because more people are... On my way here, I saw somebody selling face masks on the street.
True.
And the people who actually need it will not get the chance to use it. This is not being kind to people. We've told you the basic things. Wash your hand with soap and water. And most people are running after sanitizers. Sanitizers are for when you're not around water and you just need to keep your hands clean. But even after you use the sanitizer for a while, you still need to wash your hand with soap and water. We've talked to you about social distancing.
What is that, by the way? What is that?
Staying away from activities that bring you into contact with large crowds.
Like the NI registration.
Yes. Mm-hmm. And like and like churches, like prayer centers, we know that there's always an accumulation of people, and the spread is very easy because it's contact and it's through droplets. So staying away. They've asked kids to come home, and some of the parents, unfortunately, are taking their children for extra classes. So they are building mini schools in the homes of their teachers. Now that we know that we have people in Ghana who have it, do you know where the teacher went to or who the teacher has contacted? There's a reason we're asking the people to stay at home. There's a reason we're asking the numbers to be less than 25. We can take care of the mild cases. But every health system, and that's what is happening outside, health systems are overwhelmed by large numbers. Now we're looking at from last week to this week, from 2 to 16. Yes, the numbers will increase because the contacts are now looking at 600, and obviously some of them will test positive. We're not concerned about the numbers. We are concerned about the fact that the health system may be overwhelmed. So if you are self-quarantined, if you are coming from a place that you know that the cases have been confirmed, or you know you have been in contact with somebody, you've been advised, keep yourself in your home. You are a suspected case. Keep yourself in your home for 14 days. You'll be able to tell if you are coughing, if you have a fever, if you have shortness of breath. They told you call. Do not walk to hospitals. Just make phone calls, because the more you walk to the hospital, you are exposing more people if you test positive. So stay at home and call these numbers. They will tell you what to do. Cover your mouth when you're coughing or you're sneezing. People care about themselves and not others. I've seen people with face masks in public transport, churches, and when they want to spit outside or cough, they take the mask off, spit outside, and then they cover it. You care about just yourself, but what about the other person? In this disease, every other person matters. Even the other person matters more than you, because once the other person is safe, that's when you're safe. If you go and buy all the sanitizers on the shelf in your shop, and the person and you are safe, you and your house are safe, and you just walk out there and your friend didn't get a sanitizer, and you touch that friend who has sneezed and is probably positive, then all the sanitizers you bought would be of no benefit. So this is a situation where we are being advised to be kind to each other. Avoid stigmatization. Please follow the simple rules. They're just simple rules, simple things to do. Stay at home. Go out only if you have to go out, because it's the contact, really. Now, the gloves that we are wearing, most of these viruses are spread through the gloves. People are even eating with gloves. Now, the gloves have become a replacement for things they do with their hands. And the thing about the gloves is that the more you wear the gloves, the more you think that your hands are clean. And that's not it. Because people don't even know how to wear the gloves. They don't know that you even need to sanitize your hands before you wear the gloves.
Really?
Yes. So then they just put their hands in the gloves and they think their hands are neat. They are touching everything with the gloves because they assume that it's neat. Some of them wash the gloves, eat with it, and they transfer germs into them. So that's why we are saying leave these things for those who are taking care of the sick people or those who are more at risk, and just practice these safety measures.
And you, obviously, just like me, not an expert in this matter, we've all been scrambling to buy hand sanitizers. You bought one. The doctor here just told you that the sanitizer you bought is actually not a good sanitizer. It won't kill the germs. No, but seriously, there are many Ghanaians out there who are falling prey. I nearly did. I mean, so what did you buy? I mean, basically, I have 3 different ones. Where did you buy that? I have this store. I knew something. I have this store that was the person gave it to me. Actually, he bought it to my office actually, and but I have 3. Proper ones in my car, for example, that I use all the time. So I just kind of keep this to augment it. But like she was saying, I'm very happy that she talked about the fact that people are using the gloves, because especially on the motorway, you know, those who give the money out when you give them the money for the toll, you see that sometimes the gloves are dirty and they still keep it on them. All right. I personally am equally guilty. I mean, there are sometimes I go to some of my colleagues in the office and I say, give me gloves. You don't sanitize it, and you just put it directly on, and you think, and you think. On Monday, I came to the office with a glove and a face mask. Immediately I entered, I mean, the office, eventually, within 2-3 hours, I've taken it off, and, you know, I just stamped it. But I want to quickly go on to the phone lines and continue with this conversation. Guess who is joining me? Yao Sichi. Hello, Yao.
Hi, Evans.
I'm excited that you could join me. You know Yao Sichi. Yao Sichi is, used to work with, what's the name of the very popular, but he's into basketball. Tell us more. Don't let me struggle like that.
All right, Evans, good evening, and let me say good evening to our listeners in regards to Annie in the studio. Yeah, so can you hear me?
Loud and clear.
Okay, all right, so I'm currently head of Right Sports. We are an sports event management company, and we do a lot of things with the youth through basketball. I mean, we do other things. I manage Zuma Nelson, so we do a lot of boxing as well.
Yeah.
Yesterday, I sent you some questions.
A few questions, and I have Dr. Owusu on the line. Hello, Doc.
Hello, Eva.
Yes, Doc, I want you to, Yausuji has a few questions. I think these questions are absolutely important for people. That's why I brought him to ask directly. Yao, you can ask the questions. Doc is listening.
Thank you very much, Doc. Good evening. So I was listening to Evans yesterday, and I had a few questions. And these questions because a lot of young people come to us
Evans,
because of work.
Sorry, Doc, can you hear me? Can you hear him at all?
I can hear you, but I can't hear him.
Okay, Yao, talk again. Let's see if Doc can hear you.
Doc, can you hear me?
Yes, it's clear now.
Fantastic.
Okay. So, Doc, I was stating that I sent questions to Evans yesterday because as a group that works with young people or basketball people or sports people, we need to be armed with a lot of information so when they come to us, we can be helpful. I was asking him that, many people have suffered from fever, tiredness, caused prior to COVID-19 outbreak. How does one distinguish between what will hitherto being considered as a regular fever or malaria from mosquito bite and now considered as a symptom of COVID-19? I've got 3 questions. I don't know if I should answer.
No. So let him answer this one first, and because I've seen a question also on the Ghana Connect page here. Same question. I just want to read that. This is from Anon. He says, "Hi Evans, I have a dry cough and runny nose. I haven't been outside Ghana recently. I can't remember having contacted anyone who has flown outside recently. My girlfriend is displaying the same symptoms as well because I took her from school last week when schools closed. I live in Pram and she's at Achimota. How can we get tested?" So he's talking about testing, but that's also, we'll come to that. But Doc, the question about how do you distinguish between everyday ordinary cough that you had before and what might be considered a symptom of coronavirus?
So, David, you cannot tell, especially when we are in the cold season now, and it's quite the weather, the rainy season sometimes comes in. Many people will have flu, and if you have cough, there are many things. Some could be due to influenza, some could be due to respiratory syncytial viruses, some could be due to other normal human coronaviruses. The only way you can tell is to test. So if you don't test, you can never tell. This is why testing is very, very important. Countries that have been able to level the epidemic curve, they have increased the capacity of testing. It's only through testing that you can isolate those who have it and then deal with it. So without testing, I'm sorry, you can't distinguish between a cold or sneezing, which is due to a rhinovirus, from a sneezing, which is due to a coronavirus.
Okay. The next question that Anon asked is, so how do I get tested? He asked. So where do you go to test?
So, there are 2 testing centers. If you are in Accra and you call their hotline, they will collect your sample and test it at Noguchi for you. And this is 24/7 in Accra. In Kumasi as well, as I speak to you now, samples keep trickling in. So once you call the hotline, at any point in time, the Public Health Division will send their team to you, collect your samples, and the labs are open. At any point in time, once your samples come, the samples will be tested, and the results will be sent back to the doctor to be able to decide on what to do next. Now, these are the 2 testing centers that we have.
I'm going to go through the lines shortly. In fact, I have it here. Let me just do that. 050-949-7700, 055-842-3426, 050-949-7722. Yes, I know the concern has come that give us a short code that we can just call and just do it. I'm going to play you the numbers shortly as we go on, as often as possible, so you can get to write them. Yes, Yao, your next question.
Yeah, from what the doctor said, it's quite worrying. It's worrying because if you can't tell the difference between what is a regular or normal cold or fever and what would be considered a symptom of it. And if everybody, once I cough at home, once I feel feverish, I now have to call the number. I'm thinking, do we have the capacity? If people in Accra listening now, Evans, once you get home and your son or your daughter coughs, you're supposed to call the number and self-quarantine. They place food in at your door and you come and pick it up. How feasible is that?
Okay, and just to add to that question, Doc, we've been asked to, if you see the symptoms, self-isolate. Is that the word?
Yeah.
Okay. So what is self-isolation, and what do you do in self-isolation? You just lock yourself in a room and hope that you don't die? Or, I mean, just break it down. In practical terms, if you say self-isolation, what happens and what must you do if you have to self-isolate? Hello, Doc. Can you hear me? Okay,
yeah,
you can take
hello.
it. Okay, yeah, okay, he can hear me. Yeah. Did you hear the question?
Can you come again?
So the question is about self-isolation. So they say if you get the symptoms and you believe you are, the first thing to do is to self-isolate, right? Is that the correct advice?
You self-quarantine.
Okay.
Quarantine yourself first. When you have symptoms, you just have to get yourself at a place where you don't come into contact with people at least 6 feet away. You should not entertain visitors. You should stay at home. You should not share your towels or utensils with anybody. You should practice hygiene and washing. So once you call the hotline and then they test your sample and it's positive, you need to be moved from whichever location you are to an isolation center so that doctors will be able to take good care of you, because you cannot predict the progression of the disease because it's a new virus. So if you have if you test positive and you stay in your home, you can't tell when you can progress to an advanced state. It is only when you are moved to an isolation center that you can be properly manage your symptoms, and after when your symptoms become severe, they will be able to come and help you. So the plan is not to have people who are positive sitting in their homes and shedding, but the plan is that those who are positive are moved out. But then before that, within the 14 days or whatever, you just have to quarantine yourself while the testing is going on. And when it's positive, you are moved out.
Okay,
your colleague raised an important concern. That doesn't mean that anybody who coughs and sneezes will have to test. Unfortunately, where we have gotten to now, where the community transmission has been triggered, this is where we have to come to. Previously, it was imported cases. So you talk about having contact with someone who has come from an unaffected country or being with someone who is COVID positive. We have moved beyond that stage now, where people don't know who they have come into contact with, and then they begin to cough. So one thing you will expect the government to do is to be proactive quickly in expanding the testing capacity. And we have developed countries all around. As I told you, in South Korea, 20,000 tests were done in a day, almost a day, continuously until they were able to level the epidemic curve. So you want an aggression in expanding testing and making testing available to everyone who shows these signs and symptoms. This is the only way you will identify those who are positive and then separate them from the other people. So you don't run the risk of having many people exposed and overburdening our health.
There's a question you asked about, do we have the capacity to do that much testing right now? I mean, you work at KCCL. Do we have that capacity?
So, David, as we speak now, we have capacity to some level, and this is what KCCL has called on government to support us as an institution. The government is very happy if government can increase the number of equipment which we use for testing, so that we'll be able to do more. But in addition, there are mobile portable PCR machines that can be deployed. Some of them that work on batteries. They can be deployed at the borders. They can be installed to increase and enhance testing capacity. And you could have a policy where Noguchi and KCCL will cooperate with these portable devices, where other people could be able to do these tests, and then their results or their samples will be double confirmed. So there are other countries have done this, and this is the time for government and the ministry to begin to find out what others are doing. What is the success story out there? What have people done? And if they means getting more equipment from the developed countries to our well, to be able to enable us to do this, we have to do, because if you don't increase the testing capacity, there is no way you'll be able to get those who are positive. And you don't succeed in that, then you should be ready to have many people.
You're so right. I mean, I listened to the WHO's latest advice, and they said right now the best thing to do is to test. Annalisa, the difference between self-isolation and quarantine is what?
Okay, so self-isolation is a confirmed case. Self-quarantine is if it's a precautionary measure. So if you feel that you've been in contact with somebody who is a confirmed case or a probable case, then you self-isolate yourself. 14 days, you stay, watch and observe yourself for the fever, the dry cough, and then the shortness of breath, other symptoms. So self-isolation is for confirmed cases. And then some people talk about the social distancing. So the social distancing is also all the measures that we deliberately make to place a physical distance between us and then the people in the community. So all this cancellation of schools, 25 people at an event, working from home, all this is social distancing. But once the case is confirmed, it's isolation. Once you think that you have been in contact with somebody who may be confirmed or who is a probable case or who is a confirmed case, then you self-quarantine. Okay. So that's the difference.
So question, and again, another question that y'all sent me yesterday was, okay, so you go into self-isolation, right?
Yes, self-quarantine.
Self-quarantine. What do you just stay there, or
no.
you try and treat yourself with what?
You don't treat yourself. It's a precautionary measure. So I think I've been exposed to somebody who may have it. I'm not even sure if the person has it.
You just lock yourself in a room.
Lock yourself in a room
and do nothing.
You don't use the same things that your family members use.
Okay.
You make sure that you are keeping at least 6 feet from anybody in your home. So you're not coming into contact with them. You are not using their towels, their sponges, nothing. You are in the room alone. They put food at the entrance for you, and then you pick it up. Yes, and you observe yourself. So at that point,
the most important thing is the distance. You are alone, so you don't spread it.
Yes.
But you don't.
And you don't share anything.
You don't self-medicate. So it's when the doctors, when you confirm and they take you away, that they then put you on.
In self-quarantine, when you start seeing these symptoms, then you call the doctors and tell them.
But if you are tested, like the positive case told us, and they say you have.
That one is self-isolation. Their doctors will handle you. They will decide how you should be handled.
He told that he's been on vitamin C. That's
so
what he's been on.
It's based on your symptoms and then they treat symptoms, and it's supportive care mostly because currently there's no real medication for it.
Dr. Owusu, final thoughts just quickly before we wrap up in these times. What would you say finally? What's the most important message you want to leave us with? Okay, I think we've lost him there, but I want to quickly connect. Anil Sabuti. Yes. So
I think the education has been very instructive, and there are a lot of things that she covered that I'm very pleased with. Especially the fact that we don't have the treatment drug for it, but you need to also take some measures. For example, you talk about the orange.
Yes, you need to take a lot of fruits and vegetables. Stay hydrated. You should exercise. You just want to do things to boost.
You should exercise.
Boost your immune system. But I thought they say you should rest during that period. I mean, I'm just curious. Rest when you're sick.
Yes.
Or rest
when you're sick.
Yes, but we're not talking about things to protect yourself.
Okay, so now
and boosting your immune system. Now, yes.
And this over here.
And so I'm very glad that you talk about it. For me, from where I say it, I think that it is the misinformation that is really getting people. And I think Ghanaians, we are overly dramatic. Long before this COVID-19 came, people have been coughing, right? People have been having issues. Then all of a sudden, people think that when they cough, then eventually they have that. Okay, and for me, from what I said, I'm not an health expert, but I think that these are some of the things that really pile up the pressure on our people. So you have a lot of people mailing to hospital centers or whatever just to go and get themselves tested, and they don't even have it, but they still insist that they need to be tested. I'm not saying that don't take precaution or don't follow the steps in order to stay well, but I think that we are becoming overly dramatic in this whole thing. People are panicking for nothing. And again, I'm very happy that the media is leading the charge and bringing in experts to speak to the issue, because that for me is comforting. Okay, instead of handing a microphone to exactly, for them to come and trade who's doing well or who didn't do well and things like that. That will exacerbate the issue. So I'm extremely happy that I have you. I've listened to a lot of people about the whole thing, and it's a collective fight.
We are in this together.
Exactly.
We are in this together. Exactly. I want to connect to we say we are in this together, but let's connect to people who really are in this. I want to go to Italy and speak there to Opon Chichiku. Hello, Opon.
Hello. Good evening.
Good evening. Thank you very much for agreeing to join us in these dire times. Italy has become the epicenter in Europe. Also joining me is Luis Abedi. Hello, Luis.
Yes, Evan.
Professor Luis Abedi. You are in Germany. Are you on lockdown?
Partially.
Partially. Okay, good.
Lockdown.
Okay, I want to start with you, Upon. So Italy, how many deaths you have today and infections as of today?
Today, as at the time I came to speak to you about 30 minutes ago, there is a periodic briefing by the head of the Civil Protection Unit. So it puts the figure of cases around 47,000, and the dead is 4,032. The number of people who've been cured of the virus is 5,129. And in the last 24 hours, 627 people have died as a result of the virus.
Okay. Now, describe what is it like to be in lockdown? When they say the city is in lockdown, how you living it? What is it like?
Well, the term lockdown to me is a bit subjective because there are reasons for people to venture out, either to buy food, to go to work, or to do something which is of extreme importance. And anytime somebody tries to, adopt any of these measures, they really have to count the cost, because this virus is an invisible enemy, and we are like in a war situation. So you never know when you venture out where a sniper might be hiding on a rooftop.
Very, very graphic, very graphic description. Abedi, so you are in Germany. I mean, yeah, Germany is not as bad as Italy, but it's still bad in a way. How are you holding up?
It's still that bad, because Germany has now recorded about 18,328 cases, 52 deaths, and then I think 180 have recovered. And in Berlin, where I stay, I think we have 731 cases so far. So it's quite high here as well, and there's a lot of panic also within the city. So I think that on Wednesday, the chancellor announced, she gave a nationwide address, and that there was going to be a partial lockdown because it's a federal state. Each region, had to take a decision as to what to do in such a circumstance. So in Berlin, we had, sort of a partial lockdown, and what this means in terms of Berlin is that supermarkets and grocery shops are generally opened, and so we can still go to the stores, to get food items, and public transport, which is Germans, I can even say that around the world, German has one of the best public transport systems, and it's still operating. So we could go wherever we want to go, but when you are sitting in the train, there's a lot of fear, as to what to touch and what not to touch. And, so we are still coping. And for me, I'm even now almost done with my school, and I'm waiting for my certificate. And my university is now closed down. And
so you want to travel? You want to come to Ghana?
Yeah, I think I would like to come to Ghana.
You think?
Because the cases in Berlin, in Germany keeps, rising, and I don't know where it's going to. Where it's going to get to,
listen, I think we can be optimistic. Louis, thank you very much, Abedi. Thank you, Chichiku, also for joining us from Italy. Anil Sabute, as we wrap up, I mean, journalists such as us, we're curious about the coverage that we are getting. You've talked about the local coverage, but the international coverage. Our friend of ours, Nana Kofi, unfortunately, time is run up. I was going to call him in. He has said that the international media should start showing us the dead bodies and that they should respect our dignity. They always fly in during Ebola and show the dead bodies being mass, buried, etc., etc. But he thinks that's the point you disagree with. But he has a point, hasn't he? Very briefly,
he has a point in a way, but I do not think that. Is really a major issue, right? Because nobody's stopping African journalists from going to Italy to go and cover the stories. It's not as if African journalists sit and they give money or plane tickets to Western journalists to ask them to come there. You understand? Are African journalists willing to go to Italy and cover COVID-19? It is not. It's a global pandemic, right? It's affecting everybody, and that is why even countries are on lockdown. They are shutting down their airport and are not asking people to come in. It is not the same as Ebola. Ebola was worse, yet local people were using Twitter to tweet. There's a historical antecedent to this whole discussion, for example, so we may not necessarily have the time. You understand? But it dates back to even when Africa had authoritarian regimes who were controlling the media, and therefore our only source of news for most journalists was to look up to the global news.
Yeah.
But so you could do an analysis and water it down. The African journalists who move into exile.
So we say we should, if we want a coverage like that, we should spend some people to.
Yeah, but the point is that the Western media.
We'll hire you. Hello, somebody. Thank you very much, Annalisa.
Yeah.
I'm grateful for the insightful, education we got, and also to Dr. Owusu and all those who connected tonight. Let me share with you the number you have to call if you suspect you have may have a case. It's 055222. 004 055222 004. And you can call these numbers for help. You could go to the Ghana Health Service page or so online. You can find the numbers there and reach out to them as well. Enjoy the rest of your evening.